Good afternoon. My name is Jagdeep Ahluwalia, and I'm the founding secretary of the Indo-American Chamber of Commerce of Greater Houston, which I currently serve as executive director. I want to introduce our chamber executive committee, our board, our directors at large, and our advisors. Bhavna, can we have the slides, please? I want to thank Indra Vishnumpet for helping put together today's webinar. I am proud to be wearing my TMC tie and look forward to arranging a meeting between India's Consul General, the Honorable Aseem Mahajan, and Dr. Lawson and the leadership at CHI St. Luke's in the near future, once we are past this pandemic. Today's webinar will be recorded and forwarded to all the participants, and we will load it to the Chamber website, IACCGH.com. We are proud to be serving the business community for over 21 years, and we work closely with our sister chambers and associates and our media partners. Today we have as our partners the Indian Doctors Association, the Indian American Nurses Association of Greater Houston, a 25-year-old organization of Indo-American nurses, TIE Houston, India House, and Seva International. We thank Seva International for live streaming this webinar. We have invited Dr. Jignesh Shah, President of the Indian Doctors Association, to make some remarks on behalf of all our partners. Dr. Jignesh Shah, a partner of Gastroenterology Consultants PA, the largest private practicing GI group in Greater Houston, completed his training in pediatrics, internal medicine, gastroenterology, hepatology, and nutrition at the University of Louisville. Dr. Shah serves as a clinical assistant professor at Baylor College of Medicine. Few of his past appointments include chairman of Department of Internal Medicine, section chief of Division of Gastroenterology, and a member of the Executive Board of Harris County Medical Society. Dr. Shah has received numerous accolades, including Physician of the Year and Rising Star in Texas. It's my honor and privilege to invite Dr. Jignesh Shah to make some remarks.
Thank you, Jagdeep, for the Chamber's partnership. This pandemic has not only brought in a lot of uncertainties, but it continues to teach us newer ways to manage our patients and keep our community safe. I would like to take a few minutes and talk about Indian Doctors Association. Our core mission is based on our new adopted vision of connecting, inspiring, and community. In 2019, we held 16 events and 5 events this year prior to COVID. Since March, we have changed our direction to the pandemic by providing expert physician specialty awareness videos on social media, telehealth support to those in need, financial contributions to the Houston Food Bank for affected families, PPE for first responders, and meals for our resident physicians in training. Within the last 6 months, we gifted 2 endowment scholarships, one to the University of School of Medicine, and the second one to the University of Texas Medical Branch. The scholarships will be awarded every year to first and second year medical students. Our hope is that it will foster the growth of caring and compassionate physicians in the greater Houston community who will eventually become our future leaders in medicine. On behalf of the IDA board, I would like to thank today's moderator, Mrs. Indra Vishnumpet, and panelists, Drs. Lawson and Lembeki, Mrs. Youngblood, and Counsel General Aseem Mahajan, for not only leading our community, but taking time out in their busy schedules to discuss how to continue to tackle this pandemic. Executive Director, Mr. Jagdeep Ahluwalia, and Attorney Tarush Ranan have continued to cover all aspects of this pandemic with their great partnerships with the Estonian nonprofits. Thank you once again for providing these critical resources to our community.
Thank you, Dr. Shah. It's a privilege to be working with all our community partners. We will be, again, thanking them at the end of today's program. I now want to introduce the chairman of our board, the president of the Indo-American Chamber of Commerce, Tarush Anand. Tarush is an attorney by profession and a partner at the law firm of Brown Sims, where he practices civil litigation. He has represented a broad range of domestic and international businesses in various types of business disputes across the country. He received several awards and honors over the years, including an AV preeminent rating from Martingale-Hubbell and selection to the Texas Super Lawyers Rising Star list for several years. It's my honor and privilege to invite Tarush Anand, the president of the chamber and chairman of our board, to make his welcoming remarks and to introduce Indra Vishnambet.
Thank you, Jagdeep, and good afternoon, everyone. Welcome to our webinar today. For those of you who are chamber members or have been part of our organization before, welcome back. For those of you who are new to us, let me tell you a little bit about who we are. We're a chamber of commerce that's been around for 21 years now. We exist to do essentially four things: to facilitate trade and commerce between the US and India, to facilitate market access for Indian companies in the US and vice versa, to be the voice of the Indo-American business community here in Houston, and finally, to support businesses and professionals in the Houston area and help them succeed. We've been doing those things successfully for 21 years now, and with your support, we're going to do it for many more years to come. COVID-19 obviously has had a huge impact on businesses across the board. There have been new challenges and new opportunities, and we've been here to help businesses fare through this as well as they can. Our webinar series has been in place for several months now and has been really well received by businesses and members, and we look forward to doing many more of those. And I think today's webinar is going to be another great installment in this series, and we look forward to it. So with that, let me move to introduce our moderator for today. Indra Vishnambet is a board member of St. Luke's, Texas, and the chairperson of the board for St. Luke's in Sugar Land. She's also a senior VP of a company called Extivia, which is a technology services firm. She's responsible for the overall operation and sales of the Enterprise Information Management division of the company globally. She is strongly involved in the community. In addition to her two board positions at St. Luke's, she's a member of the Leadership Houston Class 34, a Texas Women on the Move 2011 nominee, and a recipient of the 2007 Women Entrepreneur of the Year Award from the Indo-American Chamber of Commerce. She's been a guest lecturer and a mentor at the Wolf Center of Entrepreneurship at U of H's Bauer School of Business. We are honored to have Indra as a member of the chamber and a supporter of the chamber, and we are very pleased that she's here with us today. Welcome, Indra.
Thank you so much, Tarush Anand, and thank you everyone for inviting us to partake in this panel session. I have the privilege of actually moderating this session with the three individuals that I will be introducing today. So let me start off with Doug Lawson. Doug is actually currently the Chief Executive Officer of St. Luke's Health, which is actually about a $2 billion plus regional health system in Texas, which has around 16 hospitals stretching across southeastern section of the state. He also serves as the Senior Vice President of Operations for Common Spirit Health, a Chicago-based parent company of St. Luke's. Dr. Lawson began his health career at Scott & White Memorial Hospital and a clinic in Temple, Texas. He also served in Kansas City with St. Luke's Health System and later in Huntington, Virginia for Cabell Huntington Hospital. Following these leadership roles, Lawson returned to Texas and became the president of Baylor Scott & White Medical Center in Grapevine, and was also asked to serve as the president of the organization's North Texas Central Region and Baylor University Medical Center in 2015, which is when we had the honor of having him on board. And before that, he was, in addition to his role, he's also accepted the current role in the Common Spirit as of 2018. Dr. Lawson is a graduate of Texas A&M, Gigamaggies, where he earned a Bachelor's of Science degree in Political Science. He went on to complete his Master's of Science degree in Healthcare Administration from Trinity University, San Antonio, and a doctorate in philosophy from Dallas Baptist University. Dr. Lawson is also a fellow of the American College of Healthcare Executives as well. Dr. Lawson, we are honored to have you be part of this session today. What I would like to do is start off this by having you speak a little bit about how to keep our community safe. There are a few slides that we'd like you to go ahead and talk about, and after that, we will go ahead and start the panel session. Thank you so much.
Indira, thank you so much for the kind words and the opportunity to talk to such an important part of our Houston community. If you go to the next slide, I want to first take just a few minutes and talk a little bit about our organization, who we are, and really what makes our organization unique in the United States. But one of the important things for us to talk about is sort of the mission of the organization, the statements that make up who we are. I think this is an important statement about our national organization, which is, you know, we make the healing presence of God known in our world by improving the health of the people we serve, especially those who are vulnerable, while we advance social justice for all. Never have those statements become more important than today as we talk about social justice for all. We're making sure that everyone has equal opportunity to the services and the opportunities that the United States represents. You can see at the high level what Common Spirit represents. We're the largest faith-based organization in the United States. And we take that role very seriously, both on the advocacy perspective, but also making sure that that mission exists at a local level to serve people of all faiths, all backgrounds. And we're very proud to serve in that role. You can see at the national level what the basic elements of what we're trying to accomplish. Advocate for healthy populations, which we'll talk a little bit as we go through our discussion today. Inspire workforce to achieve and fulfill their callings. We want to really make sure that we are helping people transform into the person, the individual, the leader that they truly aspire to. Addressing the unique needs of persons experiencing vulnerabilities. One of the most significant part of our social platform is making sure that we are calling out opportunities to address human trafficking at a national level and certainly here in Houston. And then we move into an advanced, a coordinated, systematic, and customizable approach to serving those with acute, chronic, and complex conditions. Healthcare is very unique. Everybody has a different set of challenges, a different set of medical issues that we need to help resolve, and one size truly does not meet all. But we also know that we're in a new world, a new age, never more so today with the recent promotion of remote medicine. And we want to enhance our consumer engagement. We want to reach people where they need us, not expect people to come to us. And digitization and innovation is going to be clearly an important part of where we're moving into the future. Next slide. As Indira mentioned, we represent one of the largest divisions inside of Common Spirit Health. We have 92 access points, 16 hospitals, 12,000 employees. We have a number of employed physicians and providers, but equally important are the number of aligned physicians that we work with on a day-to-day basis, which totals well over almost 4,000 providers that we work with on a day-to-day basis. But you can see we cover a fair amount of the state of Texas as it stands today. But clearly inside of that, we have a number of key partners, including the Texas Heart Institute, Texas A&M, Baylor College of Medicine, our premier academic partner, Kelsey Siebold, Texas Children's, and many others. We do take a lot of pride in promoting and challenging ourselves to be amongst the best in the United States. We are recognized in a number of important ways, and we're not going to be happy until we are listed in all 12 of the U.S. News and World Report rankings, and really recognized as one of the top academic centers and academic health systems in the United States. But clearly we're moving in that direction. Our vision is similar to the national platform. We want to create competitive and comprehensive programs and services anchored by our flagship academic medical center, Baylor St. Luke's Medical Center, creating an accessible and efficient delivery platform. Accessible and efficient. We'll talk more about that as we go through, but our ability to deliver efficient care is never more important than it is today. A pluralistic and highly aligned medical staff, a medical staff that is comprised and built upon the strengths of the independent physicians, our academic partners, and those that belong to large national groups. We work with all and take a lot of pride in aligning those various groups across our healthcare system and integrated and efficient operations, but also engaging with key customers and payer partners to create a more value-based structure for providing healthcare. And again, never more important than today as we see the economic challenges that our business partners are facing today. Our ability to partner with them to provide really efficient care is going to be key to the economic recovery of our Houston community. Just briefly on the COVID-19, I know many of you see this data on a day-to-day basis. We are clearly seeing an increase in the infection rate across the city. These are primarily slides that the Texas Medical Center puts out daily. I, along with my colleagues that run the other health systems in Houston, meet almost every morning at 7 a.m. to review this data and to discuss the implications on a healthcare system. You can see as a daily growth trend, this is actually yesterday's data. You'll notice the extreme increase as of 6/16. That was primarily the result of a bolus of patients that were included from our prison systems that artificially inflate that number, but even normalized for that one-time occurrence, we continue to see a pretty significant spike on the 16th, which obviously is concerning to us all as we watch and try to reopen and work to reopen the economy safely. Next slide. No surprise, much of the increase is tied back to Memorial Day and some of the reopening activities. We have some business partners out in the community who are very disciplined around their reopening. They have hand hygiene centers at the doorway of their businesses. They are requiring masks as you enter their organizations, and they're very serious about social distancing as customers enter their establishments. We were on a call with the mayor earlier in the week to discuss this phenomenon, and Governor Abbott asked me asked me specifically, but all of us in general, if we were concerned about the increase or worried about the increase. We're obviously concerned. As it stands today, we have adequate capacity, and Liz and Brad will be in a position to talk about that more later on in the talk, but we do have the capacity, as do the other health systems. It will require that we move patients around a little bit to make sure that we've got the volume appropriately placed across our systems. That being said, as we move through this, what we're seeing is a need to continue to reemphasize three core issues. The need to aggressively wash our hands, clean our hands at every opportunity. Masking continues to be critically important, not only to prevent the spread, but also reduce your risk as an individual. And the third is social distancing, maintaining distance between ourselves when we're out in public continues to be incredibly important. The governor's commitment is to actively reinforce or enforce current guidelines around all three of those as we move through the coming months. Specifically within our hospitals, we're working hard to make sure that patients are safe when they come into our organization for care. We have done it, and specifically Ms. Youngblood and Dr. Lemke around making sure people are safe when they come to our hospitals. We have allowed and opened back up for a single caregiver to accompany patients through our hospitals throughout their stay. That has been an incredibly important opportunity, or next step, I guess I should say. As we look at this, there's been some important learnings. When we entered the first surge, if you will, of the virus, we did not know what we were working with. We did not understand entirely how the virus was transmitted. We had a lot of concerns about the infection rates within hospitals themselves. We were very concerned about adequate protective equipment for our staff and our patients. As we've moved through the last 3 months, we've learned more about the virus. We've learned more about how the virus is spread. We've learned that we can care for patients in our hospitals safely without risking the health of our own staff. We've learned how to manage our protective equipment much more efficiently, which not only reduces the cost of care, but also allows us to keep our patients and families safe, and at the same time extend our capabilities to open back up to the elective work that keep people comfortable and allow people to live more healthy lives. We've also learned how to socially distance within our own hospitals. We've learned that a single caregiver, not only we can not only manage that, but we can do it in a way that actually improves the health outcomes of the patients we're caring for. The other thing that we've learned, I believe, across the community is that we can work from home and we can do it very effectively. And our system, and I think this is occurring across the community, is really revisiting what our remote work policies are going to look like. And as we bring people back into the offices, making sure that we have protocols and procedures in place to keep people safe will be incredibly important. Again, you can see some of the trends, and you can see for our health system, we've seen the highest number of cases that we've ever seen, clearly more than we saw with the initial surge. And this is a scary slide. It certainly is a cause of concern. But as it stands right now, we continue to have the capacity to care for the patients who need us. That being said, across the communities, we must reinforce to our families, our friends, our business partners, that the three things that I mentioned earlier, aggressive hand hygiene, masking, and social distancing, must be reinforced if we are to continue the reopening of our economy. All of us want the economy reopened, but as our healthcare leadership will continue to reinforce, we must do that safely, or it will force us to either limit healthcare services, which is not safe, and ultimately will damage our economy far worse than the rise of this, than the incident of the virus itself. So with that, Indira, I think I've covered some of the high marks. I hope that I've set the table for the panel discussion, and look forward to the questions that you may have and others may have as we go forward.
Doug, thank you so much. Yes, you have definitely covered quite a bit, and actually made me want to change a bit of my questions as well, since you've covered some of those that I actually had in mind. So, and more information to the community is always better than no information. And so I really appreciate the fact that you were able to cover the slides from that we just went over. With that said, in addition to Doug, we have two brilliant, very passionate individuals in our panel as well. Dr. Brad Lemke, as well as Liz Youngblood. Now, I do have a bit of an introduction for them, but I will say though, that just reading out all of their educational background wore me out here. So with that said, let me introduce Liz Youngblood. She is actually has one of the toughest jobs, being the president of the Baylor St. Luke's Medical Center, as well as the senior vice president and chief operating officer of the Texas Division of Catholic Health Initiatives. So quite a lot that she has on her plate. In her role, Liz is responsible for ensuring the effective and efficient operations, including managing and defining metrics to achieve clinical operations and financial excellence, ensuring alignment and implementation of a high quality, cost-effective, integrated healthcare delivery system, and integrating the system's strategic plan into operations. Liz is actually a registered nurse. She received her diploma from the nursing of Ona M. Wilcox School of Nursing. She has a bachelor's degree in general studies from West Texas A&M and an MBA from SMU in Dallas. Liz is also a fellow in the American College of Healthcare Executives. Liz has served on multiple community and business state boards, including SMU Cox School of Business Alumni Board. She is the past chairperson of the Board of Directors for Quality Texas Foundation. Liz has been named a top 50 leading business women by the Mississippi Business Journal and has been recognized as a distinguished alumni for SMU Cox School of Business. Liz, thank you so much for taking the time to join us in this session. Dr. Lemke joined CHI as a Senior Vice President and Chief Medical Officer in 2018. In his role, Dr. Lemke works closely with the CHI Texas Division Chief Nursing Officer, to drive clinical excellence, operational efficiency, physician and employee engagement, and multiple disciplinary teamwork. Prior to joining CHI, Dr. Lemke started working at Baylor University Medical Center in Dallas as an internal medicine hospitalist. Over his 21 years at BUMC, Dr. Lemke kept a clinical practice, built and led a largest hospitalist group, ultimately caring for over 400 patients per day. He held administrative leadership positions in case management, utilization, quality, patient safety, and informatics. Some of the very key important factors when running a hospital. Dr. Lemke also served at BUMC Chief of Staff for 3 years and was Chief Medical Officer from 2013 to 2018. He also helped start and grow an accountable care organization and later served as a chair of the Quality Alliance Board. Dr. Lemke actually is born in Texas, Houston. He graduated from Texas A&M with a BS in biochemistry. He attended UT Health Science Center Medical School in Houston as well, graduating with honors. Dr. Lemke completed his internal medicine training at UT-SW Parkland Hospital in Dallas, Texas, and he attended Cox School of Business at Southern Methodist University, where he graduated with MBA honors. Can everyone put their phone on mute, please? He also is a diplomat of the American Board of Internal Medicine. Dr. Lemke and Liz Youngblood, thank you so much. And Dr. Lawson, we also appreciate you answering a few questions as well. Now, I will give a breather to Dr. Lawson and start with Dr. Lemke here. Questions that keep coming up is, where are we in regards to treatment of COVID? Can you discuss the availability of such treatments across the country, across our community? And I'm going to add on saying one more, which is, what is a convalescent plasma and how it works? I appreciate if you can give us an answer for all these three.
Certainly. I hope you can hear me okay?
Yes.
So we've learned quite a bit since COVID came, in December in China. And, a nice thing about, if there's nice things about COVID, one is that the healthcare, communities have shared information and shared learnings. And so there was a lot of initial thought that some treatments were valuable, and I think everybody, got on board quickly and started doing clinical trials. I think the hydroxychloroquine was one of the top ones that were out there early, and of course President Trump touted that. We now know that that's not helpful for the treatment of COVID-19. The one study that has come out that has shown an improvement in length of stay and a trend towards improvement of mortality is a medication called remdesivir. And it is an antiviral medicine that's been around for a while, but that is produced by Gilead, and the government has actually taken over distribution of that and distributes it to the state, and then they distribute that to the healthcare systems and allow us to share with all of our hospitals. So we, within Texas Catholic Health Initiatives, receive remdesivir from the state and assure that each one of our hospitals are able to treat patients. And it's only for hospitalized patients. So it's not for if you're asymptomatic or if you're mild and you're at home. It's not really indicated for that. It's only for those who have some significant disease that require hospitalization and are low on oxygen. The other things that we've learned is that a new trial came out recently about an old steroid, dexamethasone. You may have seen this out of Oxford. It's even so new that it hasn't even hit the peer-reviewed literature, but it's something that we've thought may be helpful. And so that's probably something that will be rapidly being adopted and validated across the entire United States. And that's readily available. All of our hospitals use it commonly. A few other things we do know is that COVID causes a kind of a hypercoagulable state, so you clot a lot quicker than usual. We have people having strokes, we have children with these blue toes syndromes. So anticoagulating our patients is very, very helpful, and it's a standard practice. The way we oxygenate patients has changed since we first started. So we've learned about being able to better oxygenate them, and so with that being said, the availability of those medications are pretty much available. The remdesivir is the one that we'll have to see. We continue to get weekly shipments, and we hope we continue to get those, but that's again a week-to-week answer. The convalescent serum is an age-old treatment that has been around for decades, and the concept is that your body makes antibodies, an immune response to an infection, and so that if you take those antibodies, so they are in the plasma of someone that's been infected, if you take those out and then give them to someone who's infected, that someone else's antibodies may actually help the person who's infected. So those are under clinical trial right now. And so, the donors of the plasma have to have a confirmed COVID test positive, as well as have the antibodies in their blood, and then has to be the same blood type. So it's really like a blood transfusion. And so the blood banks and Baylor College of Medicine have been coordinating that effort, and there are multiple trials going on to deliver that. And so more information to come related to whether or not it's beneficial or not.
One question that came from the attendees: is polio vaccine being considered for treatment?
I can't hear you, Indira. I'm not sure if...
Can you hear me now? Can you hear me?
Indira, I can hear you, so it may be something with...
Yeah, with Brad's.
Yeah.
Okay.
We can all hear you.
Okay, sounds good.
Me.
Yeah. So let me move on to asking a question to Liz while we get this fixed with Brad's speakers. So coming to the hospitals, we did talk about, how Doug did talk about how hospitals are trying to ensure that patients and visitors are being kept safe. What steps are being taken to ensure employees and physicians also remain healthy? And another question is, have hospitals eased up on the number of visitors and visitations for COVID patients or other patients that are being admitted?
Okay. Well, we look at health in a really holistic way. There's obviously the physiological health, but there's also the psychological and spiritual well-being. So as healthcare workers, we work in the service of others, and many of us do that because, as what you heard Doug describe earlier, we see that as a calling. But that doesn't make it any less stressful when something like a novel coronavirus comes along. So the health and wellness of our staff and our physicians is, definitely something that we focus on. There are things that we do to protect our staff from the virus, such as the use of personal protective equipment that we supply. We do a lot of training to make sure that our staff understand how to take care of patients safely. And then, of course, there's extra staffing to make sure that we screen all people who come into the hospital. And we've done a lot of work to make sure that staff understand how to put the personal protective equipment on correctly and also to take it off correctly. We have multiple hand washing and gel stations throughout our facilities that are available to anybody. So we do a lot of things to try to protect the physiological safety, if you will, of our staff and our physicians. But there's a lot that we do to help with the emotional well-being of our team. And we have really been blessed to have a tremendous amount of support from the community. We've had everything from meal donations to mask donations. We've received many notes and signs showing support for our healthcare team. And that really lifts the spirit of our staff and of our physicians. And so we are truly grateful for that continued show of support. We also have a spiritual care team that provides support directly to our staff and our patients, and they round routinely on our teams, and they make themselves available to anybody who's in need of their services. We've also done some non-traditional things in support of our staff. For example, we actually opened a spa in one of our closed units at Baylor St. Luke's Medical Center, and it just created a place, a quiet and peaceful environment for staff and physicians to get away from the stress of taking care of some of our very, very sick patients, and it allowed them a place to recollect and sort of re-energize, if you will. We've opened grocery stores in many of our hospitals, so our staff have the convenience of being able to purchase the needed supplies and take them home versus having to go out after work and purchase groceries and other needed supplies. And lastly, we really believe that when people are well informed, it reduces their stress levels, and as we all know, stress impacts health. So we've done a lot of work to make sure that we're communicating to our teams and that they have the information that they need. And we do this through leadership rounds and virtual town halls and daily newsletters and other types of updates. So a lot of work goes into making sure that our staff and our physicians stay well and stay healthy.
Okay.
Related to the visitors and the visitation, so currently under the Health and Human Services Commission rules, we actually are not allowed to have visitors in the hospital. But what you heard Doug talk about earlier was a single designated caregiver, and that is allowed. And that's somebody who is essential to the care and the recovery of a patient. And we recognize and how important it is that a designated caregiver be there with the patient. It helps them with their health, it helps them with their treatment, and it helps them with their recovery. So we allow single designated caregivers to come into the hospital during designated times so that they can participate and help with the recovery of their loved ones. We also have been and continue to use virtual visitation methods with iPads and cell phones in the form of Skype and other virtual platforms to help our patients stay connected to their loved ones. So we continue to promote the connection of patients to those that are important and significant to them.
Thank you so much, Liz. Dr. Lawson, I'm going to jump over to you. This is a question from the attendees here. With the rising cost of healthcare during the pandemic, lowering reimbursements, what strategies do you recommend for offices-based medical practices? This is coming from a physician group.
And I think it's a question that all of us are concerned about right now, and that is how do we take the learnings that we've had from the past several months and apply them in a way that allows us to provide more efficient, more effective care. One of the more important lessons that we've learned is the use of telemedicine. Yesterday, for example, I had a chance to, or earlier in the week, I had a chance to actually escort a man and his wife by wheelchair through one of our hallways. She was struggling a bit, but they were from a small town outside of Houston, about 100 miles away. Their initial contact with our transplant team was via Zoom. And we conducted the preliminary initial consult electronically. The physicians were able to review all of his clinical material, access much of the data, and have the initial consult and conversation with the patient and his family while they were in their home without having to travel to Houston. More convenient for them, they were thrilled with it. It set the stage for what to expect as they moved into the hospital, helped them answer questions about how to navigate the Texas Medical Center and what can be a very complicated environment. And they could not have been happier. We've also had some of our subspecialty consults at Baylor St. Luke's Medical Center. They've been able to do virtual consults with hospitalized patients in other community hospitals. Access their record, do a full consult with the patient, talk to the patients themselves, talk to the attending physician at the community hospital, and make a determination whether or not advanced care was appropriate or necessary without having to transfer the patient, without having to really interrupt the care that's occurring locally at all. Those are all significant cost savings opportunities for our system and make our teams more efficient. As we think about telemedicine and the ability to provide more care remotely, that means we have to have fewer clinics, and which are expensive, and makes our teams more efficient and more effective. But as we move into the next phase, those are all short-term opportunities to become more efficient. ultimately what we have to do is look for ways to be better partners for the employers across our community. The large employers, all the employers in Houston are going to be incredibly stretched and stressed over the coming months as they work to recover their businesses. Our job is to make sure that we continue to have the platform that we can be good partners with them and provide more cost-effective care for their employees. And we're working hard with that. Our clinically integrated network, Texas Health Network, is well positioned to partner with the payer community and do some important work in a number of key ways. So those are the sort of my initial takes. Any opportunity that the groups, we as a hospital, can find to make our staff more efficient, that's really where the cost savings are going to be.
Well, I had a question about the value-based care, and I know you've touched a little bit on that with this specific question that was asked by one of the attendees here. But could you talk about how COVID would actually change the way healthcare is making sure that the healthcare that's being provided to the community is efficient and effective?
One of the things that we've learned, and I'll use a simple example for this, that we've learned how to make more effective and efficient use of our testing equipment. I think we realized that in many cases we may have been over testing, and we've learned that in the short run we may not have needed to test as much. At the same time, we've also seen what an absence of testing will do to the health of the community. So delaying testing in other cases actually can create larger problems for the patients. And it's that balancing act that we have to do on a day-to-day basis. Partnering though with our employers to be efficient in the care, to provide a lower cost system for the employers is ultimately what that is. It's ultimately what that will make a difference. That's what will make a difference. So as we talk about a group of employees, 10,000, 15,000, 20,000, 500, the ability to provide care for that group more efficiently at a lower cost for that employer ultimately means that our economy will recover faster. And that's really what we're targeted at. But we can't do that alone as a single as a health system. We, especially in Houston, we need to partner. We must partner with our community-based doctors to really make that work. And that's one of the areas that Dr. Lemke has excelled in the past. Dr. McDevitt, who is the head of our Texas Health Network, all of which are working really hard to make sure that we have a platform that the community physicians and our academic partners, as well as the physicians in our employee group, can operate within and help us continue to create a more efficient platform.
Thank you so much. We are getting a lot of questions from the participants here as well. So I'm going to try to address a few that I already have as part of the Q&A and then address some of these. Dr. Lemke, can you hear me now? You're on mute.
I can, yes.
Great. Can you touch a little bit about the differences between the PCR and antibody testing, and who should opt for which testing and their effectiveness?
Absolutely.
And one final question is around surveillance testing, since we're talking about testing as well. If you can elaborate a little bit on what surveillance testing is.
Yeah.
Thank you.
So quickly, the two different tests that are out there really is, one is the PCR test. And so that is really the nasal swab that goes all the way back into the nasopharynx. So the Q-tip that goes all the way back, almost feels like to your brain. And that actually tests for the genetic material of the virus. So it tests for the actual virus, presence of particles of the virus. And the test is about 8% sensitive, meaning that about 80% of the time, if the virus is present, it will pick it up. And a lot of that is due to the technique of the test. If you can imagine, again, having that test done is not pleasant. And if the better sample you get, the more accurate it is. And that's really the gold standard right now to determine if someone is infected currently. And, you know, the antibodies, like we talked about with convalescent plasma, you know, your body makes, it's the immune response to an infection, your body makes antibodies. And so the interesting thing about antibodies with coronavirus is that we do know that people make them, we just don't know what it means. We don't know if it means that they've, you know, just been exposed or that they have any immunity to the virus on an ongoing basis. And so right now it is the serologies, the antibody testing is only felt to be valuable in epidemiologic studies. It entails a blood draw, it's part of the blood, and so it's a little different. And so right now, I would opt for the former if I were concerned I was infected. Later on, we'll probably be able to look at serologies to see if you were infected. So surveillance testing really is where you take asymptomatic populations and you test for infection. And so many of the hospitals around Houston and Texas are doing that. We are, in our organization, testing our high-risk employees to be sure that we don't have asymptomatic employees at work, as well as, you know, potential spread in our own hospitals. And so our emergency department, physicians, nurses, respiratory therapists, as well as our COVID ICUs, our COVID floors, our anesthesiologists, our rapid response teams. So we're now doing our transplant floors and our oncology floors. So our most at-risk individuals. And so that is surveillance. And we're happy to report that thus far, our ability to keep not only our employees and physicians, but also our patients safe with the protective mechanisms that we've put in place using, you know, the masks and the hand washing and gowns and gloves and all of that have been really successful. So I do tell anyone that asks that coming to the hospital is safe. We actually do a lot to make sure that you're safe coming in. Our surveillance testing reinforces that's been successful.
Thank you, Dr. Lemke. I just want to ensure that when you talk about the surveillance testing, it's the same PCR testing that's being implemented for the surveillance.
Absolutely, it's the same PCR. Yes.
Okay, got it. Thank you.
Well, and so you know, when the surveillance is offered to those high-risk people every 2 weeks, because again, it's, you know, you could get infected within that next 2 weeks, and so that's we're doing it on a staggered basis, in an ongoing basis until we kind of get over the hump with this coronavirus.
Got it. So, Liz, I have a question for you. We do have a couple of others that have come up as well, but so when people are coming in to get elective procedures done, what do you tell them as to what they need to do to prepare themselves to avoid any exposures? How to be safe? As Brad mentioned, we want our patients to come in safe, but how do we make sure that they're safe while they're there?
So we have a number of mechanisms that we've put in place to ensure the safety of people who come to our hospital. And it's important that when people come in, they follow the processes that we have in place. We have taken numerous precautions throughout all of our hospitals. Of course, we have very thorough cleaning protocols that are in place, and those certainly continue. But when you're in the hospital, you'll notice that we provide hand sanitizing gel stations everywhere. Those are available for anybody to use. We encourage folks to wash their hands frequently and properly, and we certainly have lots of different places for people to do that. Every person who comes into our hospital must wear a mask, and if they don't have one, we provide one to them, and we show them how to put the mask on and how to wear it properly. We've also set up a number of our waiting areas and other public areas in a manner that promotes physical distancing. And lastly, I would share that our staff is very knowledgeable and well prepared to care safely for anyone who comes to our hospital, and are always available to assist and answer any questions that folks may have.
Thank you so much. I do have a question from one of the participants here, and I'm going to read this out. How does variation in number and types of tests daily affect indications of daily number of confirmed cases? Is this a variation that should be adjusted or normalized? Not sure if the panel is.
So I'll try to take a stab at that. And,
okay.
And maybe, I'm not sure if I understood exactly, but I do think testing has become more available, and the number of tests that have been done, and we're catching more positive cases. So if you just look at the general prevalence in the community, you know, we're testing more people, and so we're getting a more accurate picture of what really the true infection rates are. And so that is, you know, partially due to truly it's spreading, but also due to more testing. So yes, we do take that into consideration to a certain degree. What I do think is something that is kind of a standard factor that evens the playing field a bit is that we've always been testing the ones that were sick enough to get admitted to the hospital. And so the increased testing out in the community, those aren't coming to the hospital, but our rise in hospitalized patients are really the concerning part too. So I think we are seeing both a increased number of positive tests, but also our hospital numbers are rising. So that still tells us that we have a true rising number of acutely ill patients.
Thank you so much for that. Now, we have about 10 minutes for the panel session, just to do a quick time check. Doug, I have a question from one of the participants here. It's great that telemedicine has caught on with healthcare facilities. Will the reimbursements for virtual visit continue to be the same as in-person visits? I think we're talking more about the effectiveness as well as the economical impact of telemedicine here. Can you talk a little bit about that?
Yeah, I think that's one of the bigger questions that we're working with at a national level, is to advocate for the current level of reimbursement for telemedicine consults. Early on in the crisis, CMS really provided reimbursement equivalent to an in-office visit for a telemedicine consult. It was incredibly helpful for us. It insulated our staff from some of the economic impact of mass conversion into telemedicine visits. In many cases, we went from a rate of 10 to 15% telemedicine consults to 40, 50, and in some types of practices, almost 100% virtual consults. So obviously the economic reality of how we're reimbursed for those telemedicine consults is going to become incredibly important. That being said, I think we must go back and reassess our cost structure and put ourselves in a position to provide telemedicine services using a different expectation of reimbursement, because I think that's ultimately where that's going to land. And so we will aggressively and adamantly advocate that the telemedicine consult and the in-office consults require the same level of intellectual and technical expertise. In some cases, the infrastructure may be increased. We're preparing ourselves to provide that service at a reduced reimbursement.
Thank you so much. Now, have any of you heard about any plans for on-site testing at large corporations? Just going towards the continuity of going back to normalcy soon enough.
Yeah, I know the Greater Houston Business Partnership is evaluating that as a recommendation. The infrastructure is not quite there to support that. I think the implications to the employee workforce for the general communities is something that the business community is struggling with. How do you respond in the event of a positive employee? They clearly, potentially, if they've not used adequate social distancing within their employee groups, they potentially have a far more significant issue. And so I think the business community is really struggling with how to respond to this right now. Clearly, the government, the state and local officials have not mandated or issued any recommendations in that space at this point in Durham. So I think that's a to be determined issue. That being said, the county and city, really the county, is preparing to actively do contact tracing of all positive cases, and then contact those that have been in physical proximity with individuals who've been diagnosed with a positively diagnosed. That's going to help us also better inform the community about the spread of the disease.
Thank you so much. There was a question about polio vaccine being considered for a treatment. Can you touch upon that?
Yeah, I haven't heard about polio vaccine for as far as the treatment is concerned. You know, most of the world has been vaccinated to polio, so I'm not sure how that would work, but I do know there are multitude towards the vaccine. And, you know, one question we always get, and I think someone asked, you know, when might one be available? And boy, I think you probably hear Dr. Fauci as much as I do, and I think we'd be happy if it were within this next year. There's some promising ones out of, again, the UK. There's some out of China we hear. There's one locally in the United States that are actually kind of moving into the second phases of development. And so hopefully, number one, the ones that are in that phase have been tested to see, number one, are they safe? So they're not going to hurt someone. And then really moving into the are we effective? So I think that's where we're trying to get into the effective stage.
Thank you so much. I'm sorry, I was just asking all of you a question before, Brad, you joined. Is there anything that I have not covered that you think that we need to address in this session today?
I think you've done a fantastic job, Indira.
I agree.
Thank you so much. I only asked the questions. So I think we have one more follow-up question here on the vaccine. Some quarters seem to think that the BCG vaccine will almost all Indians born in India provide some degree of immunity from COVID-19. Any opinion on this?
So there's actually a clinical trial looking at just that here at Baylor College of Medicine is doing, and we've offered that. We've sent that out to all of our employees and physicians actually that wish to volunteer for that clinical trial. So the logic behind it is interesting. So I think we'll see. It's one of those things that we'll have to see.
Okay, thank you so much. Any other final thoughts? If not, I am going to hand the baton back to Jagdeep. Thank you so much for taking the time today to answer all these questions and participating in this panel session.
Jagdeep, thank you very much for the opportunity. We are incredibly honored to participate in today's session. I'm hopeful that the information that we provided has been of use and will help us safely move forward in the face of a very significant health crisis. The three things that I would continue to reinforce, and if you don't carry anything away from today, it's the three, and you've heard me say it hopefully 3 and maybe now 4 times. Effective hand hygiene, often. Soap, water, in the absence of that, an antiseptic foam or a cream, I mean, some type of hand hygiene on a very regular basis is incredibly important. Masking is becoming more and more apparent that is a key tool and must be used. Social distancing, discipline around social distancing must continue. And we can do that in the face of reopening our economy if we have a lot of discipline and purpose as we move forward. So thank you again for the opportunity to address this important group. And we're there for you and happy to answer your questions, comments, or concerns at any point in the future. Thank you.
Thank you, Dr. Lawson. Dr. Lemke, can we have a final word from you, sir?
Sure. You know, you guys are all role models in your communities and beyond. And I just ask that we all be role models here. You know, I've got kids that are teenagers or so that really, you know, don't understand and struggle with complying with universal masking. It's complying with social distancing. We really have to be those role models and continue to communicate that. Not only the medical community is one, but just the leadership community that you guys represent. The more people we have delivering that message, the quicker we'll flatten that curve. And we need your help.
Liz, your final comments, please.
Yes, thank you. I would just share that we've got an incredible group of healthcare providers who are here to serve our community and here to care for patients who need our services. And I would just encourage people to not avoid getting medical care. It is so important that you maintain your health and wellness. And we are here to serve, and we can serve you safely. So I encourage you to continue to seek care and services that you need.
Thank you very much. Indra, your final.
And I just want to add one thing to Ms. Youngblood's section. She has a fantastic group of nurses. And she is working incredibly hard to make that group of nurses recognized nationally as the best group of professional nurses in the United States. And I think the nurses in the community would be proud to work for Liz and the team there at Baylor St. Luke's.
Indra, final words from you before I introduce you.
Well, Jagdeep, thank you for the opportunity here. I've seen other webinars, and I appreciate the fact that we were able to pull this together. And sitting in the sidelines as a board member, I will say, though, that I am very proud to say that during this crisis, the healthcare system has definitely taken, definitely have been excellent in the way that they have provided care. And I think the more we educate the community, the more we can benefit from the curve flattening. And I hope that that does happen pretty soon. And thank you so much again for the opportunity.
Thank you, Indra. I would like to bring to the attention of the panelists that every Indian family that I know has at least one healthcare professional in their family. So it's either a doctor or a nurse or an administrator, but I can't think of a single Indo-American family that does not have a healthcare professional in their family. And we are proud of the great work that these healthcare professionals are doing across the country, across the world. We're always scared when they are in the middle of such a pandemic, and many people I know have had the COVID and have recovered and then have gone back to working as doctors or nurses. So our hats off to every healthcare provider across the country, and especially to CHI St. Luke's and your team, because you do a lot of great work for the community and you've been strong supporters of the chamber. With that, it's my honor and privilege to introduce the Consul General of India in Houston, the Honorable Asim Mahajan. He joined the Indian Foreign Service in 1998. Prior to assuming charge as Consul General of India in Houston in January 2020, he was the ambassador to the World Trade Organization, Geneva. In his earlier diplomatic assignment, he had served as the Deputy High Commissioner in the Indian Mission in Kuala Lumpur and in Dhaka, and as the Consul General of India in Osaka, Japan. He also served in Indian missions in Tokyo and Laos. In his stints in the Ministry of External Affairs, New Delhi, he has served on various desks handling affairs related to United Nations, Bangladesh, Sri Lanka, Myanmar, and the Maldives. Besides, he has also served as a staff officer to the Minister of State for External Affairs and as Joint Secretary coordinating the management of the annual Hajj pilgrimage from India. He has a master's degree in diplomatic studies from the University of Oxford, UK, a master's degree in management studies from the Birla Institute of Technology and Sciences, Pilani, India, and has completed 2 annual training courses in World Trade Organization, the Advisory Center on World Trade Organization law in Geneva. He speaks Japanese apart from English, Hindi, and some other Indian languages. He is married with a son and a daughter. It's my honor and privilege to welcome our chief guest today, the Consul General of India, the Honorable Aseem Mahajan.
Thank you, Jagdeep and Tarush, Dr. Lawson, Dr. Lemke, Liz, and of course our moderator Indra. It is really a pleasure for me to join, as always, your webinars, which I think you're basically connecting many people, many important professionals, many people for the benefit of the community. And during these times when this is the new normal, we all connect digitally, and these have been extremely useful for us, both in terms of the information which is shared, but also in terms of connecting with people like all the doctors today and institutes, St. Luke's and other institutions in the past. So I think what I really found it very informative. Now we are, of course, in our lifetimes, at least I can say we have never seen a situation like this when we are going through this pandemic, these lockdowns, flight bans, so many other measures, and so many things which we were never prepared for, so to say. And of course, which was also mentioned by some of the other panelists, what healthcare workers and first responders are going through in dealing with this pandemic, the scale of the pandemic, the pressure on our healthcare systems, our infrastructure. So these are all challenges which we are all jointly going through. And I would like to mention 2-3 things. Number one, of course, is that we have been collaborating with everyone during this pandemic, and this has also thrown a big opportunity for us to strengthen our cooperation between India and United States. We are working on many joint initiatives together. There are many vaccine research trials which are taking place with the partnership of institutes in United States, with companies in United States, with companies in India, and many academic institutions which are there with us on drug trials. Many Indo-Americans are present in a large number in medical and healthcare category. There are a lot of doctors who have pioneered and who are doing research on many areas related to this pandemic in general, but also in many other areas of healthcare which is there. So we are trying to scale up our collaboration in this area. We are trying to connect institutions. Already there is a very strong connect with the Texas Medical City. We are trying to work with them to find more partner institutions in India. The global supply chains for healthcare and also for things like PPE equipment and other medical devices. This is another area which we have recently explored, and it holds tremendous potential for both United States and India. There is a lot of synergy in this area, which we can work together and capitalize on. India also, like as both the doctors have mentioned and Liz also has mentioned, we are also trying to take very proactive measures. All countries are trying to do that. India also happens to be a country where we have scaled up our infrastructure of medical healthcare, and it's a country of 1.3 billion people. So therefore, obviously, the challenges are huge and different in some ways. But I'm happy to say that our lockdown was very effective, and we are trying to do our best to cope with this current pandemic. And another area which of course may not have been mentioned, I was listening through, but is about this global solidarity trials, which are taking place. WHO has partnered with the Indian Council for Medical Research. Similarly, Indian Council for Medical Research is also working with the National Institute of Health and the CDC in USA, and they are doing many joint things together. Now, this is the whole, as I said, the canvas is very wide for us to further strengthen our collaboration in healthcare and medical research. And I really look forward to the guidance of people like Dr. Lawson, Dr. Lemke, and of course, Liz, and all of you to share ideas with us, to share thoughts with us on what we can do together, whether it is joint research on some area related to this pandemic, a drug trial, or any other research studies, and going further even in partnering with institutions together, sharing exchange of knowledge, trying to do things which we can jointly do together, and other areas of healthcare where you people have competence and you can guide us on how we can plug into the supply chains together. A lot of Indian companies are wanting to come here. In fact, on the last thing I wanted to mention is, which is obviously digressing a little bit from this subject, is also this, that we have recently released a report in which Texas has emerged as the state which is attracting the largest number of companies and also the largest amount of FDI from India. Almost 9.5 billion worth of FDI has flown into Texas from Indian companies. And on that note, I really want to again thank all of you, the panelists today, for educating us on this very important subject. As we move along, we will look for guidance for people like you to deal with this and keep our communities safe. And as it was aptly put, we have to find a balance between opening the economy, at the same time trying to keep our communities safe, trying to adopt the measures which have been brought into place by experts like you, by the states, by the cities, and by various governments. And I'm sure at the end of it, at least I have remained very positive that our US-India partnership will be strengthened further. It is already multifaceted, but we are deepening it at various levels as we are speaking. And I find that growing interest on both sides, which is a very positive thing. And thank you again, Jagdeep ji, for giving me this opportunity, and stay safe.
Thank you very much, Consul General Mahajan, for being an advisor of the Chamber and for always being available to the community at large. You've really been a pillar of support and one of the best representatives India could have had in Houston. We are very proud to be working so closely with you ever since your arrival here. On behalf of the IACCGH President Tarush Anand and our board, we thank you, Consul General Mahajan, and CHI St. Luke's for your continued support. I want to once again thank Indra Vishnampet for helping put together today's webinar, and Dr. Lawson, Dr. Lemke, and Ms. Youngblood for sharing their knowledge and insight. I want to once again thank our partners. So Indra, if you could show our partner slide, and these are all our community partners, not just the ones. This is an upcoming event on June the 22nd, but these are our community partners that we work closely with for most of our community activity. I draw attention to this event on the 22nd, where we will be talking about mental health and anxiety during the pandemic. And we have a young doctor who will be sharing her knowledge for the benefit of the community. Again, the partner slide once more, Indra, just for the benefit of our community. These are all the Indo-American organizations we work closely with, in addition to the consulate, in serving the local community. We also have a large number of media partners, and I'd appreciate if you could display their slide for the benefit of our viewers and listeners. So this is a group of media partners that help spread the word, which gets the word to a much broader cross-section of the community, including Indian television channel TV Asia, which broadcasts excerpts from all our events. I do want to draw attention to Gopal Sarjani, the scientist I have often bragged about. He is the founder of Ansh Labs, and he is in advanced stages of FDA approval for his antibody tests. I have forwarded the information to Indra to forward to our panelists today to see how he can connect with you to be of service, because he's a man I've known for the last 15 years and he's a very service-minded person. I believe his tests are as good as any of the tests by any of the largest labs across the country, but he's a very humble man who doesn't project himself, and that's why we have to keep trying to project him to make sure people know that he exists. I invite you to visit IACCGH.com to learn about upcoming events. We want to thank everybody who attended today's event. The recording will be loaded on our website. With that, I request you to stay safe and follow all social distancing norms. Wear a mask if you step out, and see you at our next event. Thank you very much.